Good evening, everyone. My name is Raypon, and for a while now, it has been a dream of mine to one day work in global health. This summer, with the kind help from the Bixby Foundation, I had the opportunity to live out this dream by working as an intern with UNAIDS. Living along Lake Geneva, I enjoyed a morning walk to work each day. If I close my eyes, as I approach the UNAIDS building, I can see the WHO directly to my right. And for me, it was just so surreal, knowing that in the building directly across the street from where I work, decisions are being made that impacts the health of billions of people. During my 3 months at UNAIDS, I worked on a number of different projects, from doing typical intern work, from making copies to sending faxes, to doing data analysis on ART adherence, and at the national and regional levels. I also conducted a literature review regarding key populations within the HIV/AIDS epidemic. But most of my work mainly concerned stigma and discrimination. And what I learned from my time there was that stigma and discrimination, despite all the progress we've made, even within this last decade, this is a lasting barrier that stands in the way of what many consider the most deadly epidemic of our generation. I learned the lesson of stigma and discrimination became apparent to me early on. In early July, my supervisor tasked me to take notes at a workshop being hosted by our team regarding national health identifiers. And for those of you who are unfamiliar with national health identifiers, they are a means of using identification and attaching one's health status to it. And say if you have HIV and you are registered within our system, this information becomes accessible. For me, as an epidemiology student, I thought, well, yeah, that makes sense. This makes things so much easier in terms of collecting data, designing studies, ultimately just gaining the information necessary to help eliminate this disease. As I soon found out, though, as the workshop began, was that things are never this simple, which is probably why they have the workshops. Representatives from countries most deeply impacted by HIV and AIDS were present, making their voices heard, all with the purpose of coming together to work together to come up with a solution. Representatives from the key populations within these countries were gathered there, also making their voices heard, but more importantly, making the concern of stigma felt. It was this weekend that it became apparent to me that the stigma associated with HIV is felt more deeply in some communities and some populations in some countries more than others. It was this weekend that the stigma associated with HIV became more real and apparent for me. I had the chance to meet people who were personally affected by this, who live with this fear and discrimination every day. For me, it was a special opportunity to witness firsthand how they approach these complex situations. How even with the large number of people gathered there were different groups with different backgrounds and different priorities, but all united together in the same fight against the same deadly adversary. For me, it was a small glimpse into the world of global health, but it reminded me of why I wanted to work in global health in the first place. To tackle issues such as this, to help bring health to those who feel stripped of that right. It wasn't just that weekend, but my entire time in Geneva, and most importantly, the people that I had a chance to work with and learn from, that inspired me and lit a fire in me. And as my time ended there, and I prepared to come back to Los Angeles, I left feeling even more determination to someday come back. Thank you.